Hi, this is Dr. Pandey. Welcomes you all to the Health Awareness video program. In our previous video program, we have seen few of the clinical features and symptoms of hypothyroidism. In today's program, we will see hypothyroidism diagnosis. Before proceeding further, for hypothyroidism diagnosis, let's quickly review the thyroid hormone formation. In hypothalamus, thyrotropin hormone secretion will take place, and in anterior pituitary, thyroid stimulating hormone takes place, where the thyroid gland secretes T3 and T4. We call T3 as triiodothyronine and T4 as tetraiodothyronine or thyroxine. Now, to diagnose the hypothyroidism, there are few list of investigations which may help us to study the hypothyroidism. Now we will see what are the list of investigations which may help us to get the study of hypothyroidism, where T3 and T4, TSH, TRH, antibody, segmentation rate, ultrasound, CT scan and MRI. These are the few list of investigations which may help us to study the hypothyroidism diagnosis based on the stages wise. Now, the hypothyroidism is divided into three, which is primary hypothyroidism, secondary hypothyroidism and tertiary hypothyroidism. The most common seen is primary hypothyroidism. Rare the secondary hypothyroidism and very rare tertiary hypothyroidism. In primary hypothyroidism, where we can see the low levels of T3 and T4 and high levels of thyroid stimulating hormone. Now, what could be the reason for low levels of T3 and T4 and high levels of thyroid stimulating hormone? In function, we have gone through that our antibodies act against the thyroid gland, which in turn reduces the thyroid hormone secretion, and few of the viral infections also may reduce the thyroid hormone secretion, as well as few drugs and iodine levels of our body may also reduce the thyroid hormone secretion. These are the few reasons because of which the thyroid hormone secretions will get reduced. Now, what are the few causes which may lead to the primary hypothyroidism? The causes may be antibodies like Hashimoto thyroiditis, as well as postpartum thyroiditis, where we have seen that lot of blood loss or hemorrhage during the pregnancy or the delivery, which may lead to the within 1 year the low levels of thyroid hormone secretions. Apart from this, we have seen SGT, subacute granulomatous thyroiditis, where the viral infection will affect the thyroid gland to reduce the thyroid hormone secretion. Drugs like amidorine, lithium and iodine may also reduce the thyroid hormone secretions. Apart from this, the iodine levels in our body may also reduce the thyroid hormone secretion. These are the few of the causes which may lead the primary hypothyroidism. Now we will see the secondary hypothyroidism, where in secondary hypothyroidism, due to any reason, if the anterior pituitary has reduced the function of secretion, then the TSH levels will be low. When anterior pituitary TSH levels are low, reduce the secretion, then the T3 and T4 levels will also be low. That's the reason why in secondary hypothyroidism we can see in the lab investigations that TSH, T3 and T4 levels are being recorded low. The most common causes for secondary hypothyroidism is trauma, brain injuries or tumor. Apart from this, syndromes like Sheehan, where due to excessive blood loss during or before the pregnancy or delivery, where the blood cannot reach properly to the anterior pituitary, where the hormone secretion levels being reduced, which affects to the thyroid hormone levels. These are the few common causes for secondary hypothyroidism. Now we will see what is tertiary hypothyroidism. If due to any reason hypothalamus is reduce the function, where the thyrotropin hormone levels will be recorded low, as well as the anterior pit, because the hypothalamus secretion has reduced, then anterior pituitary will reduce the thyroid stimulating hormone secretion. When thyroid stimulating hormone secretion has been reduced, then T3, T4 levels will also be get reduced. The reason why in lab investigations or in the studies which has been seen in tertiary hypothyroidism, where TRH, TSH, T3 and T4 levels are being recorded low. Now the common causes for this are trauma, injury or tumors. These are the primary hypothyroidism, secondary hypothyroidism and tertiary hypothyroidism causes and studies. Now apart from this, there is one more hypothyroidism called as congenital hypothyroidism. Now in this congenital hypothyroidism, where within 24 hours to 48 hours, within 24 to 48 hours, if thyroid function, thyroid hormone test or TSH, T3 and T4 investigation is to be performed on the baby, where if these levels are low, then it can be studied as hypothyroidism to the baby, as congenital hypothyroidism. These are the few glimpses of hypothyroidism diagnosis. We will meet with few other information related to thyroidism. Thank you. Have a nice day.